Hà Lan xin chào tất cả quý khán giả. Xin cảm ơn quý khán giả đang theo dõi buổi tọa đàm về sức khỏe ngày hôm nay. Xin chúc cho tất cả các bạn có một ngày mới thật tràn đầy năng lượng và an lành. Buổi tọa đàm này được thực hiện bởi Regent Health Asia, là một phần trong chuỗi các buổi tọa đàm về sức khỏe của chúng tôi. Tại Regent Health, chúng tôi mong muốn chia sẻ những kiến thức quý giá để tăng cường, bảo vệ sức khỏe và là cầu nối kết nối bạn với các chuyên gia y tế tại Việt Nam cũng như Singapore để cùng đưa ra sự tư vấn về y khoa phù hợp nhất với bạn. Chủ đề của buổi tọa đàm ngày hôm nay xin được nói về bệnh ung thư vú, và chương trình rất vinh dự khi được trò chuyện cùng với Phó Giáo sư, tiến sĩ, bác sĩ Mikael Hartman. Và bác sĩ Hartman sẽ chia sẻ những kiến thức chuyên môn của mình về chủ đề rất quan trọng này. Bác sĩ Hartman hiện là trưởng khoa phẫu thuật tổng quát tại Bệnh viện Đại học Quốc gia Singapore. Ông đã tu nghiệp tại Singapore từ năm 2009, chuyên về lĩnh vực ung thư vú và là một chuyên gia phẫu thuật về ung thư vú với kinh nghiệm nhiều năm trong ngành. Và bây giờ chúng ta hãy cùng chào đón Phó Giáo sư, tiến sĩ, bác sĩ Hartman. Now please welcome Dr. Hartman.
Hi, thank you very much for that kind introduction, and to Regent Health for inviting me.
Good afternoon, Dr. Hartman, and would you like to tell us a bit about yourself?
So I'm originally from Stockholm, Sweden. I live in Singapore. I'm now Singaporean. I'm a surgeon by training, and I specialize in breast surgery.
Thank you, doctor. And now let's move on to the answer the question list that the audience is interested in. And can you please explain to us what is the breast cancer?
Okay, so breast cancer it used to be a rare disease, not common in Asia, but it's become the most common cancer in women in Asia. So it's the development of a lump or a tumor in the breast that, if it's not treated, will eventually spread to the rest of the body.
Thank you, doctor. And the next question is, how common is breast cancer?
As I mentioned before, it used to be uncommon. So we talk about sort of uncommon. We would say that during a lifetime, maybe one woman in 45 would get breast cancer. But now in Singapore, it's maybe one woman in 13. In Vietnam, at the moment, it's probably one woman in 15 that gets breast cancer. So it's become very common.
Yeah, I see. Thank you, doctor. And what causes breast cancer, doctor?
A complicated question. There's no simple answer because there's no one thing that gives you breast cancer. But we know of a few things that contribute to getting breast cancer. One of them is having no children. That increases your risk. So having many children, it protects you. And things like early age at first menstruation and late age at menopause, it increases your risk. That becomes the number of menstruations. The more numbers, the higher the risk.
Yeah. Thank you, doctor. And how to check for breast cancer?
So as a woman, we advocate that you do breast self-examinations and you look out for simple signs like a breast lump, a non-painful breast lump. You look for some skin changes, a nipple that's always been out, that gets pulled in. But that only helps you detect breast cancer that is a little bit later. For early breast cancer, we recommend that you go for regular screening with mammograms. And you do that once a year between age 40 and 50, and every other year between age 50 onwards.
Yeah, I see. Thank you, doctor. And what are the types of breast cancer, and what are the treatment options?
Okay, so we think of breast cancer as non-invasive breast cancer and invasive breast cancer. So non-invasive breast cancer is early breast cancer where surgery only is usually enough, possibly with an anti-hormone treatment called tamoxifen or similar. But for invasive breast cancer, there are a few different types. They are treated reasonably similarly. All of them require surgery, and if they are a little bit more advanced, they will also require chemotherapy and possibly a bit of radiation. There are newer medicines that have come that are extremely effective, which are what we call targeted drugs that are particularly for HER2-positive breast cancer. And then lately, the most recent addition is what we call immuno-oncology, which are medicines that help your immune system to fight the cancers.
Yeah, I see. So how to decide on the different types of surgery like lumpectomy, mastectomy, or reconstruction?
Yeah, so that there are ideally three different kinds of surgeries. I think the first question we ask our women is it important for you to keep your breast? If it's important for you to keep your breast, and we try to save the breast by what we call a lumpectomy. A lumpectomy is then taking out a smaller part of the breast and then shifting tissue around so that the breast still looks normal. But if the tumor is larger or that the breast is of smaller size, then we have no choice but to remove the whole breast. But for women who are not comfortable in leaving their chest flat, we then offer them an opportunity to do a reconstruction. So the reconstruction can be done in three ways in principle. One is to put an implant inside, a silicone implant. The other option is to take tissue from your back and shift it forward, or tissue from your tummy and shift it upwards. So those are the three different kinds: breast conserving surgery, mastectomy, removal of the breast, and then plus minus a reconstruction.
Yeah, thank you, doctor. So, and now let's move on to the after treatment part. And I think this is also the part that the audience is also very interested in. So how often will the patient need to have follow-up exam, blood test, or any imaging test?
Yeah, so when it comes to breast cancer treatment, surgery alone is it's almost never enough. So you need to have several different kinds of treatment. So chemotherapy would be the first option, which is then given as a drip or an intravenous medicine. And then plus minus the targeted drugs that we're also able to offer through Regent Health, which we're very happy to be able to offer to our patients. And then even after chemotherapy and targeted drugs, there are other medicines that one can still offer to control the cancer, and they can be often as tablets and or as injections.
Yeah, thank you, doctor. And the last question is, how will we know if the cancer has come back, and what should we watch for?
Yeah. So I think the good thing is that if breast cancer is treated well, the chance of cure is very high. It can be as high as more than 90% of the patients are able to be cured. So breast cancer can come back in three different ways. So you can have what we call local recurrence. That's a cancer a lump in the same breast. It can show up as a new cancer in the opposite breast, or it can spread to the other organs. So we check for this by a clinical examination, where we as clinicians, we check the operated side and the other side, and we also do mammograms for these breasts. To check for spread in the rest of the body, that's done by means of different forms of X-ray. And an effective way would be to do a PET-CT or different kinds of CT scans. Because most of the time there are no signs or symptoms of this, so one would have to do these scans on a regular basis. Unfortunately, there's no good blood test that really helps us to check for cancer recurrence.
Yeah, yeah. Thank you, Doctor. Yeah, as we already know that in life, we always want to be healthy and wealthy. So, by the way, could you please give your advice to the audience who are watching the show today, how to protect their health in physically as well as mentally when they are healthy, or even while being treated for this disease?
Yeah, so it's an important question to sort of keeping a healthy mind and a healthy body. So I think that has to do with, if we start with a healthy mind, it's having a good social structure of friends and family around you as support. That's very useful, and we know that that helps patients to cope with the disease. When it comes to the body, then it's maintaining your weight, trying to keep active, and maintaining a healthy lifestyle when it comes to food and diet. Because it helps not only for cancer, but it also helps to protect your heart and your kidneys, as we expect that you will live a long and healthy life.
Yeah. Thank you so much, Dr. Hartman, for joining on our talk show today, and have a good day to you. Yeah.
Thank you for having me.
Yeah. Hà Lan xin chân thành cảm ơn quý khán giả đã theo dõi buổi tọa đàm sức khỏe của Regent Health ngày hôm nay. Hy vọng là chương trình đã mang đến những thông tin thực sự bổ ích cho quý khán giả về bệnh ung thư vú. Xin chúc cho tất cả các quý khán giả và gia đình luôn luôn mạnh khỏe và bình an trong cuộc sống. Hà Lan xin cảm ơn và xin chào tạm biệt.